Some states are seeing a sharp decline in COVID vaccinations as the U.S. tries to combat the virus and achieve herd immunity. Nearly 100 million Americans are now fully vaccinated, and 141 million others have received at least one dose. However, health officials say there's been a significant drop in vaccination rates nationwide. Omar Villafranca is in Baton Rouge, Louisiana, where a major push is now underway to entice people to receive their shot. Omar, what can you tell us?
Well, Anne-Marie, the state is still doing mass vaccination sites like this one here, but they're just not convenient for everyone. So they're starting to do things like shots for shots. It's basically vodka for a vaccine at a bar. And they're having to get creative because less than 1/3 of Louisiana's population has received the first dose. Where did you get your first shot?
I got it at a local bar.
23-year-old Brandon Bro went to a bar with friends and ended up vaccinated.
It was a shot for shot night.
In Baton Rouge, the Shots for Shots program is run by Relief, a telehealth company. The Shots program came to this bar on Tuesday night, where bartender Curtis Johnson had a shot waiting for him. Moderna, straight from the syringe.
Why didn't you go to a vaccination site or a doctor's office?
Well, the convenience is what spoke to me most today. The fact that it's literally 5 feet away from me. I work late nights. I've either just never found the time or just been too exhausted to go out.
That type of convenience makes a difference in reaching the unvaccinated, says Relief CEO Vishal Vasanji.
People trust people that they're familiar with, and so, if we're friends, I could come to you and say, hey, the process was easy, here's what it is, and it might get you one step closer to getting vaccinated.
But success varies by night. At Soji, only a handful of people got the shot.
Do these type of events help, even if it's just a few people?
They do. They absolutely do.
Dr. Joseph Cantor is the Louisiana State Health Officer. Right now, his state is administering less than 70% of the first doses delivered from the federal government.
We're taking the kitchen sink approach here. No idea is bad. Every idea is worth considering.
Cantor says when it comes to the vaccine hesitant, most are not against vaccination.
Most people just have questions. They're on the fence. They want to talk it out. They want to wait and see. It's all about empowering trusted messengers in communities.
Cantor says the best messenger tends to be people's own doctors. And that's the case for 42-year-old Katie Allagood, who has not gotten vaccinated.
Are you a hard no?
No, I'm not a hard no.
You're not a hard no?
I'm not a hard no. I was a hard no initially. I believe in science and I believe in masks. I just don't know how I feel about the vaccine. I don't get flu shots, but our kids are fully vaccinated, so it's not that. So that's just kind of where I am.
State health officials admit people are tired of hearing from the government telling them to come and get a shot. So now they're starting to reach out to church leaders to get that message out on Sunday, and the Saturday football faithful to get that message out as well. Because keep in mind, Anne-Marie, we are in LSU football country, SEC football, and that carries a lot of sway down here.
Listen, I love their approach to this. I think there are a number of theories about why people aren't getting the shot, and there's a lot of talk about vaccine hesitancy, but then access is a massive issue. When it comes to vaccine hesitancy, do we know sort of what's at the center of it, and where are I guess do we know why perhaps people may be hesitant to get the vaccine?
Well, we talked to some people who, like Katie in the story, who they just have simple questions, and they don't like getting bombarded from a lot of different sources, so they do their own research. And one thing she said she wanted to hear from was her primary care doctor, something she had not talked to her primary care doctor with, somebody she said she's been with for more than 10 years. And that's something the state is also doing, reaching out to primary care doctors and saying, have you had this conversation with your patients yet? Because that's a connection that people trust. And if that's a connection that can bridge that gap to a vaccine, the state will be happy with that.
My eye starts to twitch a little when people say they do their own research, but I am heartened to hear that she actually talked to her doctor and not Dr. Google. That's the best way to do your own research. Omar, there's a lot of people in Louisiana and across the South, quite frankly, that live in very, very rural areas, far away from vaccination sites. Do we know, what effort is underway to get those people the shots?
Well, the state realizes that if you're out in some of these parishes and there's not a lot of internet connection, that's one thing. You also may not have a computer. There's a lot of people who don't have a computer or a smartphone or an iPad. We're telling everybody to sign up. That's great if you have connectivity and you're big. The state has actually set up a call-in number, which if you have a phone, you can do it, and they will do the process for you. They will sign you up and find out where you are, find out where the nearest location where you can go get a shot or possibly have something come to you. So the state is realizing with some of their rural residents, they're going to have to go out to them, and that's the next step that they're willing to take.
All right, Omar, thank you very much.
Thank you.